Hello and welcome. I'm so pleased to tell you that my guest tonight is Michael Osterholm. Michael is the director, as many and most of you may know, for the Center for Infectious Diseases at the University of Minnesota. Research and policy is part of that CIDRAP title, and important pairing, as we know. Probably most of you have been listening and following and getting advice the past 2 years, especially from Dr. Osterholm. He's been on television all over the place in our homes. I feel like, even though I know him personally, I feel like I know him even better from seeing him on television all the time. He has been, in his career, thinking about pandemics from way back, probably 92, you started doing some writing about pandemics. He's written a lot of journal articles, a lot of books. One of the books that I think is most pertinent is called The Deadliest, help me.
Enemies, Our War Against Killer Germs.
Yes.
Published in 2017.
Enemies, which I need to reread. I've read all your books, I think, so far. So I have lots of questions for Dr. Osterholm. I think there'll be questions you're curious about too. But I want to just start out with a personal one. How are you doing with all the pressures you've been dealing with the last 2 years as kind of our go-to, one of our top go-to experts? How are you hanging in there, Michael?
Well, let me just start with the immediate moment. It's such an honor to be back on your show again. These are among some of my most memorable interviews in my whole career. We go back a long way, so thank you for having me back again. It means a lot. I have anticipated what a pandemic might be like. And so from my perspective, I saw an 18 to 24 month time period that would be tough. And in fact, there was an interview with me on CNN this past week where they went back to a interview they had done with me 18 months before, in which I said that in the next 18 months we'd have 800,000 deaths. And we hit 800,000 deaths this week at 18 months. So, I kind of had a sense of what it would be like. At the same time, I did not anticipate, nor I don't think anyone could, of the body politic, of how divisive this would become, how painful it would be. You would think that when people were dying, we'd all come together to help each other to get through that. As of today, 1 out of every 100 individuals 65 years of age and older have died from COVID in the last 2 years in this country.
And I think that is kind of a statistic that overwhelms people. And I thought today of the Stalin quote: "One death is a tragedy, a million is a statistic." And that's maybe partly affecting our population.
I think it is. However, when it's in the last 2 years, we all know people who we have loved and cared for. People who are our family, people who are our friends, colleagues who have died of COVID.
The tragic.
And, they weren't all just older people who, and some might say, well, they were going to die of something. We've had many, many younger individuals. Today in Minnesota, we're seeing 20, 30, and 40-year-olds dying. We just had our 5th teenager die in this state from COVID. And so I think that people have had enough experience with it, but it still is among those who have lost family members, who have done so much to try to protect themselves and others, and yet there are those that deny they even have COVID. They'll be in an intensive care unit, and the one thing they say before they're intubated, "Don't tell anybody I had COVID," because I don't. So there's such a divide in understanding what's happening, and that it's about us versus the virus, not us versus us. Oh, and by the way, the virus is here. And we've had a hard time getting through that.
It's a very frustrating, I think the level of upsetness about this is rising among everybody, among all groups. It must be especially awful for you when you've learned so much and it's not welcomed by this big group.
Well, first of all, I'm very fortunate. I work with an incredible team of people at the center that I direct. And the senior leadership team, we've been together now for 35 years or more. So they started at the Minnesota Department of Health with me and came to the university full time. And so that support system is more than I can ever put into words. It's like family again. I have had a very supportive family. I have supportive friends and colleagues. And I think that, part of it is the fact that as tough as it's been, I've also, you might say, wired for this.
Mm-hmm.
You don't end up becoming an English Channel swimmer just for the heck of it. When you go spend 12 hours at a time swimming in cold water, you have to ask yourself, what's going on up there? What's happening?
No, you can't just throw that little
Yeah.
line in, though. You actually tried twice, right?
Yeah, I did.
To do the channel.
Yeah, I've trained a lot that. So to me, I think I've been ready to take on long journeys. And so, as I said earlier, I saw that it was going to take this long before this coronavirus pandemic would unfold. Now, we're still seeing major challenges because of these new variants. But I think that from that perspective, I've been okay. The one area that you and I have talked about, but that has been very tough, has been in all my 46 years in the state here. And, I've been involved with some pretty tough situations. We're very, very involved in the earliest days of HIV/AIDS.
Right.
And Minnesota was the very first government body in the world to make HIV reportable, not just AIDS, because we recognized that by the time we understood AIDS, it was 2 and 3 years after people had become infected, and we were trying to understand how transmission was occurring today. Well, at that time, and for real legitimate reasons, a lot of gay men thought, oh, my name's going to be on a list, a government list. Mm-hmm. And, as tough as those days were, they never felt threatening. And today, it's not unusual for me to get death threats on a weekly basis. The kind of mail that we get and the kind of emails are pretty remarkable. And that's happening to a number of my colleagues. So it is a very different situation.
You said a lot of public health professionals are resigning, just feeling under attack almost.
Many. And, and frankly, we're at that point right now with our healthcare providers. Mm-hmm. I mean, imagine the following, which is actually happening right here in our own state. We have individuals that develop COVID who believe that ivermectin, a type of antiparasitic drug, is the effective treatment when we have compelling data. It doesn't help at all. And at the levels that they take it, it's very toxic. And imagine being an intensive care doctor or intensive care nurse, and you're caring for someone's loved one. And the family,
you're putting your own self on the line.
Putting your own self on the line. And the family sues you because you won't treat their loved one with ivermectin in the intensive care unit when you're trying to use the very best care that you can give. And then there's the battles, court battles. They've actually been sued over this. I mean, it's so hard to imagine. Recently here in the Twin Cities, we've had healthcare workers that have been, basically yelled at, spit upon. And recently in rural Minnesota, we had a situation where healthcare workers coming out of the COVID ward to their cars in the parking lot had garbage thrown on them by family members.
It's just
so I think it's just changed. The body politic has changed so much that that's made it very, very difficult.
In just a brief sentence, do you think there's anything that can convince the anti-vaxxers? Anything that
well, I've come to split the groups up into 3 different categories. Mm-hmm. There are those who are vaccine affirmative. They couldn't wait to get it. They're the ones last spring in a 16-inch snowstorm drove from the Twin Cities to Brainerd because it was the only spot open to get a dose of vaccine right away. Mm-hmm. And they couldn't wait to get it. Then we had the vaccine hesitant, who are people who had legitimate questions, pregnant women who wanted to know, would this be harmful to my unborn baby? Down the line, people who were really concerned, and they needed the information that we could provide that would assure them, no, not only was it safe, but it would likely save their lives and could save their lives. And then we have the vaccine hostile. That's the third group that's relatively new. These are people that were doing to sabotage people getting the vaccine. We've actually had them break up vaccine clinics. We've had them, really with severe mis and disinformation. We even have elected officials right here in Minnesota who will make totally erroneous statements about the safety of the vaccines, and they know better. They know that's not true.
They're really putting themselves at risk, their family members. Is there anything you can think of that can be persuasive?
I don't at this point, and, I think the price that they will pay, it's not me. There have been 3 well-known conservative radio commentators who have taken after me pretty hard, okay? And people like Dr. Tony Fauci and others. And, they don't do that anymore with me. All 3 of them are dead. They died from COVID.
All 3,
And,
I
yep.
knew two of the ones you're talking about.
Yeah, and I mean, to the extent that that is a tragedy, I don't want those people to die. And I think this is really a tough moment, where kindness is what we ought to be leading with, and it's hard. But, the other thing is that we're seeing people now after 2 years of this pandemic who, for all the logical reasons, are done with the pandemic. They can't do this anymore. They've been pinned up. Mm-hmm. They're in their homes. They're financially strapped. It's been very stressful in the family, and they're done with the pandemic. The problem is the virus isn't done with us yet, as we're seeing. Yeah. Right here in Minnesota, we have been in the top 5 states for the case incidence, number of cases per population, since September.
And that's not
people
just
are not
because
realizing
we're
that.
testing more, Mike, you don't think?
Well, this is our hospitalization levels. Look at that. I testing doesn't determine whether you get hospitalized, it's whether you get sick enough.
That's
and
true.
Right now, the majority of ICU beds, or in fact ICU units in the state right now tonight are completely full.
That is terrifying. So a lot of people with heart attacks or strokes are being shunted somewhere else or waiting in a ER room.
Tonight I have to say, Mary, there's a lot of places in the state you do not want to have an automobile accident, you don't want to have a stroke or a heart attack, because care is necessarily curtailed. And it's not because healthcare workers aren't trying to do everything they can, they are. The system is just that overwhelmed right now.
How long do you think, Mike, that we're going to have to be in this? You talked about innings last year. Now I read that you're thinking more in quarters.
Yeah,
minutes.
well, last spring, when I saw the variants develop, the Alpha variant out of the United Kingdom that was much more transmissible than the ancestral variants from Wuhan. And then we saw Beta and Gamma, 2 more variants that emerged in South Africa and South America that could actually evade immune protection. And that was a wake-up call to me. And as you may recall, last April, I said publicly I thought that some of the darkest days of the pandemic were still ahead of us.
I remember that.
That was not popular at all.
It was not.
Because we had vaccines flowing, case numbers were dropping precipitously. Right. Everybody said we're over. How many governors and the presidents had 4th of July independence from COVID Day parties.
Right.
And,
we relaxed this summer.
Yeah, and I knew that these variants were going to be a real challenge. And of course, right now, that's what we're seeing with Delta, and now with the Omicron variant here. We don't quite yet know what it's going to do, except we know it's much more transmissible than Delta.
It's more transmissible. What else do we need to know about it? That I know it's early, you probably barely have gotten a handle on it, but what do you know about
serious illness. Does it cause serious illness?
Right,
that to me right now
that's the big question.
Is the big question.
Yeah.
So, on one hand, and I surely don't want to give people false hope, that wouldn't it be something if Mother Nature helped bail us out by making a virus become the king of the virus pile, that was more transmissible but caused much less severe illness? Replace one for the other. On the other hand, as we learn more about Omicron, we may find out that it causes quite a bit of serious illness, and because many more people get infected with it, it actually means that there's going to be more cases in terms of total number that need hospitalization. So we just don't know yet.
Do you think that those of us who are fully vaccinated and have boosters on top of it, are we at risk of getting Omicron?
The answer is yes.
We are.
But the difference is, what we've seen globally so far is I'm not aware of any of these individuals having serious illness. Which,
so far.
Right now, if a vaccine will keep me out of a hospital, keep me from having serious illness, that is a vaccine that's priceless.
Right.
And so that's why we continue to say, get vaccinated. And remember, we're dealing head on right now with Delta. Delta is what's getting us, and vaccine is critical with Delta, and vaccines will prevent you from getting Delta. And that's why we also need to get not only first-time vaccinees in the door, but we need to also get the booster dose vaccinees in the door so that they get vaccinated.
Do you think this winter, from what you've heard, that the flu is going to be an added challenge?
We don't really know yet. As of today, we have one state that has elevated activity and 4 others that have moderate activity. But on a whole, seasonally right now, on a nationwide basis, flu is actually at a low level. One area we're looking at is Minnesota. Some really increases have occurred in the last 7 to 10 days. Whether that will persist or not, I don't know. A month ago, we were very concerned. There was a very large outbreak of influenza as H3N2 at the University of Michigan campus in Ann Arbor.
Really?
And everyone said, aha, here goes the season. Michigan's going to tip. And today, Michigan's one of the lowest state levels in the country.
Oh, really?
Nothing ever materialized out of that university outbreak. So I think it's really still too early to say. We also have other virus infections, RSV, respiratory syncytial virus for
That's
kids.
filling up children's hospitals.
That's been a big challenge. So it's not just COVID right now that's challenging our kids, it's also RSV. So, I think the honest answer is we don't know. And I think if anything this pandemic has taught me, it has taught me a lot about humility. Just acknowledge what you know and don't know. And as I've shared with you, I think I probably know less about this virus today than I did 6 months ago.
In spite of all your studying and,
the more we learn, the more we can't explain. Why did Omicron take off like it did? Why is Delta doing what it does? For example, we have one model I call the India model, where late last spring, early summer, we had this massive, major outbreak of Delta, which is where the Delta variant came from, in India. And the case numbers went up and were there for a couple of weeks, and they came down right to baseline where they were before. And it's been relatively quiet.
It's like a roller coaster,
exactly.
Isn't it?
And that's the same thing that we saw in the southern Sun Belt states the last 2 summers. Went up very quickly, very high, and then came down quickly. Well, then you have the UK model. The UK, when it first saw Delta in July, case numbers were about 1,500 a day. Very quickly, it went over to 54,000 cases a day. And then after several weeks, it started to come down. It only came down into the 23,000 range, leveled off, and it went back up again. Yeah. Literally, the UK has been in a surge since July. They're still up. Well, that's what Minnesota, Michigan, the northern tier of states have been. We have been in a surge since September. What's the difference? Why these surges so different? And we don't know.
And it seems to move, the surges seem to move around the country, don't they?
Right, it does. And in this case, ours are persisting. If you take Minnesota, Michigan, northern Wisconsin, across over into southern Canada, you look at the northern states in the Northeast, Maine, Vermont, New Hampshire, we all had these persistent problems. Now suddenly, we're seeing the southern Great Lakes states fill in. Illinois, Indiana, Ohio, Pennsylvania, New York, Connecticut, and it's almost like viral lava. It's flowing south very slowly, but that's why the surge is picking up. Meanwhile, we see very little activity in the western states. Why? Southern California right now has a lot of people who have not been vaccinated or previously infected. Why is it not hitting there? I don't know.
Yeah.
So
humility, as you said, is necessary.
Well, it's either that or you basically have to lie out your teeth that you know what's going on when you don't. And so I think humility is an easier approach.
Well, you've been the source for so many of us of just knowing that what you're saying is as true as it can be from what your research is.
Well, let me go back 2 years because I think it helps set the stage for this answer. So, I've spent my career obviously working on the other coronaviruses, SARS, the severe acute respiratory syndrome. I was splitting my time in 2003 between the university and the Department of Health and Human Services in Washington, working as a special assistant for Tommy Thompson following 9/11. And when SARS hit in China and then spread to a number of countries around the world, and particularly Canada was one really hit hard, I did a lot of work on SARS. Then in 2012, when MERS, the Middle Eastern Respiratory Syndrome, a similar kind of coronavirus, got launched in the Arabian Peninsula with camels as the source for that. Right. I was very involved as an advisor to the royal family of the UAE. I know the royal family there. So I spent time on the Arabian Peninsula. Then in 2015, when an individual came back from a trip to the Arabian Peninsula to Seoul, Korea, was infected, went to Samsung Medical Center and started a major outbreak there. And so I was in Seoul helping to investigate that. All of those outbreaks with the coronaviruses were, in a sense, a gift from a public health standpoint, unlike influenza, because you didn't become infectious till the 4th or 5th day of your illness. And so if we could find you soon after you had onset of symptoms and we could connect you with the case, we could isolate you and stop transmission just like that. So fast forward now to December 2019. And our center wrote one of the very first stories on Wuhan that was in the world. And in fact, it's interesting, we should talk about that because I just talked to the individual today who was one of my primary contacts on the ground in Wuhan at the time. And so we were really getting good intelligence out of there, despite the fact that they said China tried to hide it. We were getting good information. So early on, the first week of January, I just assumed this was going to be another influenza pandemic emerging and thought, boy, we're in for a pandemic. And then by the end of the first week of January, we knew, no, it was a coronavirus. Well, I went, yippee, that's great.
I know that virus.
We can stop that, okay? And then by the 10th, it was clear that this was not another SARS or MERS, that people were highly infectious 2 and 3 days before they got sick. And in some cases, they didn't even get that sick yet. They were highly infectious. And by January 10th, we saw cases in Hong Kong and Singapore, all over there. All the fast trains and airplanes go through Wuhan in the center of the country. So if you're going from Beijing to Hong Kong, you go through Wuhan. And it's an area of 30 million people. And so this was ripe for the spread of the virus. And so by January 10th, we had clear evidence that this was different. And at that point, I went, oh no, this is flu, except as a coronavirus.
So it's sneakier.
That's why this early transmission issue is huge.
And there's nothing we can really do except test, right? Do you think we need to really ramp up our testing here in the country?
Well, we should. The problem is the same people that won't get vaccinated are often the same people that won't get tested. And
That's
so they
true.
happen to be the ones that are some of the most important transmitters of the virus in the community. It's also about distancing. You know, it's also about, events where respiratory protection. You know, I think we did a very poor job as public health explaining respiratory protection and masking. You know, much of the masking that we do today is really hygiene theater in a sense because it's so inefficient. It leaks, it's not efficient filters, whereas the N95 respirators, like I came in with here tonight, actually are very efficient in helping keep the virus out. So if someone is in public places, besides being vaccinated, if you wear that N95 respirator, you can do a lot to protect yourself.
I know in one of the editorials recently you referenced the website that we could go to get the N95. And we'll put that up on the screen.
Good.
Now.
And we have plenty of them now. You know, a year and a half ago, we were in short supply. And we said, please don't use them because we need them for our healthcare workers. Now we have plenty. And so that's the other thing people can feel good about, and you can buy them at basically any hardware store, et cetera, because the vast majority of N95s respirators are actually used for industrial purposes. You know, painting, chemical exposures, et cetera. And so that they're readily available, and that's what you want to get.
What about the booster? I mean, we know we're supposed to get it. Is there anything you can tell people that is going to tip them to say, I better go get the booster?
Well, it can be the difference between life and death, so that should be a starter, okay?
Bottom line.
Yeah, bottom line. But let me just back up a little bit. You know, when the pandemic began, we obviously were searching for vaccines that could be brought forward quickly and effectively. And we did that kind of research literally in light speed. And I can say absolutely beyond any shadow of a doubt, safety was always a primary consideration, so no shortcuts were taken to understand the safety. But how to best use the vaccine, that we didn't really do. We set up a research approach, and we never really looked at how well that would protect you. What is the right dose, meaning how much of the vaccine? What's the dose spacing? How far apart should they be?
I was surprised when I read that spacing is maybe has not been what it should have been.
Well, think about this. If I asked you to run a marathon every day of the week for the rest of the year, how do you think you'd be feeling by about the end of December? Okay?
About
well, the
2
immune
days.
system is a lot like that in the sense that you challenge it, you let it have this robust response, let it recover, then hit it again. That's when it works. So the reason I bring this up is because I early on challenged the notion that this 2-dose approach was the right way to go. Meaning that we had to go with what we had. Those are the data. We could show that it worked in those first weeks after the 3-week or 4-week second dose. Well, what would give us a long-term protection? And so I've always thought that this was probably going to be a 3-dose vaccine, and that the J&J would be a 2-dose vaccine. And now, sure enough, that's what we're seeing. After 6 months, we start to see this waning immunity, and we need that booster dose. And that can make all the difference protecting you.
Mike, we're out of time already, but had we spaced out the first 2 shots further, would the immunity have been stronger at this point?
It would be, but I still think we probably always were talking about a 3-dose vaccine. And we're going to be looking very closely at people who get the 3rd dose and see what their immune status looks like, 4 to 6 months from now. And, we're learning a lot here. Let's just be clear. We're painting this plane at 30,000 feet, okay?
Yeah.
And I just want to reaffirm, though, it's not about safety. We're figuring out how to get the best response out of it. How do you get the most protection? And that's what we're doing right now. And I can tell you for certain that those booster doses are really important.
Well, on that note, we have to say goodnight. I so appreciate your coming down.
Thank you.
Wish we had 2 more hours.
This went too quickly, Mary.
I know it went way too quickly, but thank you so much. We're going to put resource information on after we say goodbye to Michael. He's got a podcast every week. We can tune into that. We'll give you a link for that and some other good articles. So thank you, and thank you for all the work you've been doing for all of us. Yes, we love to have you here in our state and claim you as ours, but you're really the whole country's now, so.
Thank you.
Way to go. Thank you for being with us. I'll be back again next week. Until then, have a good week.